It's always best to avoid promising work that you will not be doing. If a patient asks a physician for something that's in the social work area of expertise, it's best to defer that to the social worker and let them know that the social worker will see them about that issue or concern. As social workers, we manage a lot of resources in the hospital, and with those resources, there's rules and criteria to access those. In addition, we do assessments and make clinical judgments on whether or not a resource is appropriate for a patient. And so when a physician makes a promise to a patient that the social worker will come in and do this for them or give them this, it could be a little frustrating for the social workers. If we're not able to provide that resource, the patient will often get angry or upset, and it can ruin the trust between the social worker and the patient and the physician and the patient. When I'm seeing a patient and they start asking me medical questions or for anything medical related, what I always say is, you know what, I'm not the expert in that. That's the physician, but I will let her know that that's your concern, and she'll come see you later.
So one important takeaway is that each of us actually hold only one part of the larger picture for a patient. The best outcome we can hope for is that we all respect that we each have our own areas of expertise. So you have the medical piece, and that's the reason the patient is here, is for the medical piece. We know that we can't talk to a patient about the things that you can talk about. We can't treat them. We can't cure them. We can't impact what they are actually here for. If you come to us knowing that maybe you can't understand their whole social context, their whole environment, their past, their mental health issues, their psychological distressors, their family dynamics, and all of those things. And to know that you understand that we may come out with a different piece, we may come out with a different perspective, and that we will share that back with you so that we can kind of complete the puzzle with our piece and your piece and whoever else's piece that we end up needing.
It's important that we know what the estimated discharge date is so that we can plan accordingly, more specifically for case management and discharge planning, so that I can have a deadline for my work to be done. So for example, a patient needs IV antibiotics and home health. I know that they are leaving 4 days from now, or their estimated discharge date is 4 days from now. That gives me 4 days to assess the patient and secure the things that they need for discharge by that discharge date so that they can leave when they're ready to leave. I have great physicians on my team. They are always present at rounds. They are very communicative with me, and I know that they're going to communicate with me effectively about their estimated date of discharge and what I need to accomplish as a case manager in order to fulfill that.
Another recommendation I have for you is to always ask for input. I think it's important for physicians to always be aware of other team members and the role they play, and to always ask questions. Rounds is a good forum for that, but anytime there's concerns about a patient or you feel like they have a social work need, to page the social worker and ask questions. I think it's also important to, when you're asking for help or feedback, to incorporate our ideas and what we have to offer. And if not, let's have a conversation about why that is. We can both learn from that. We know that we're being heard when when the person stops and listens to us, when our feedback is incorporated into what's happening.
So one big tip is to come back to the other people on your team and to acknowledge the work that they have done. Everybody likes to hear that they have contributed in a meaningful way to the work with a patient, to work with other professionals on the team. So there are lots of ways to acknowledge the work of somebody else on your team, including the social worker. One way is to acknowledge them actually with a patient. If you have a shared interaction, to say that you have trust in our work or respect respect for our work and you appreciate our role in helping that patient's care. Another way is to acknowledge us among other staff members, right? To say that you actually did your homework to see what we had done beforehand and that it looked like a lot had already been done before we had gotten to this point. To acknowledge that there are things that you haven't seen us do, but you know that we do anyway, just like we know the same for you.